Hello, today I want to show you how solving one of the biggest health challenges for astronauts in space can lead to a revolutionary way to diagnose cardiovascular disease for everyone on Earth. My name is Rahul Gupta, and I'm a rising senior at High Technology High School in Lincroft, New Jersey. I'm passionate about the intersection of biomedical and computational science because I've loved finding connections between different fields to solve complex and real-world problems. What truly drives me is a belief that a solution designed for a handful of astronauts can be adapted to help billions of people, which led me to the project I'm excited to share with you today. Let's start our journey in the most extreme environment imaginable, space. In microgravity, the human cardiovascular system goes haywire. The heart weakens from cardiac deconditioning, bodily fluids shift upwards, stressing the system, and the risk of life-threatening blood clots increases. As NASA researchers found, just 6 months in space can age an astronaut's arteries by the equivalent of 10 to 20 years on Earth. This makes space a unique laboratory for understanding heart disease. Now, let's bring that problem back down to Earth, where the scale of the crisis is staggering. Cardiovascular disease is responsible for 17.9 million deaths every year, making it our undisputed number one killer. But this isn't just a number, it's a crisis of equity. As this map shows, the burden is not shared equally. Around 4 out of every 5 of these deaths occur in low and middle income countries. This reveals a core issue, a crisis of access. Billions of people lack basic diagnostics, yet the vast majority of these deaths are preventable with early and accurate risk assessment, the very resource that is missing. So how do we diagnose this today? Well, doctors rely on a mix of methods, including expensive and often inaccessible imaging tests like ECGs and CT scans. But the system is deeply flawed. It costs upward of $500 per assessment. Its average accuracy hovers around a mere 78%, and as a result, a shocking 1 in 4 high-risk cases are missed entirely. This led me to ask, is there a better way? The answer came from looking at space medicine. In that living laboratory, we see that the true drivers of cardiac risk are factors like inflammation and cardiac stress. This was the key insight. What if we could build a more accurate and direct model of risk by focusing on the blood biomarkers for these factors, completely bypassing the need for expensive imaging? Based on this insight, I developed my model. It's called CardioPredict. It's important to note that this is an advanced medical algorithm, not a black box AI, which makes it interpretable and trusted by doctors. It works by synthesizing evidence from official NASA protocols and the clinical guidelines from the American and European cardiology societies. It analyzes a panel of over 10 biomarkers from a simple blood test, and I validated the entire model on a data set of 247 individuals from real-world space missions, bed rest studies, and clinical settings. So, how does the algorithm actually calculate risk? This flowchart shows the architecture. First, it takes in the values from a blood test and then performs a weighted analysis, giving more importance to powerful markers like troponin. Next, it applies a environment-specific multiplier, understanding that risk in space is different than in a hospital, for example. Then it models synergistic risk, knowing that multiple factors together can be far more dangerous. Finally, the output layer provides a single, easy to understand risk score, giving doctors a clear and evidence-based foundation for making a clinical decision. But a powerful algorithm is only useful if people can access it. That's why I built the CardioPredict web platform. As you can see from this quick demo of the live application, it's a clean, intuitive interface that brings the power of this complex engine to any healthcare provider with an internet connection. It takes just seconds to load sample data or input new values and receive an instant validated risk assessment. It fulfills the three promises of global health technology: superior access, a radical cost reduction of over 90%, and real time results. Now, for the results, With a validated accuracy of 94.2%, the CardioPredict model demonstrates a clear and significant improvement over existing clinical standards. This represents up to a 50-point increase in accuracy compared to widely used tools, establishing a new benchmark for predictive performance. Diving deeper, the model's clinical performance metrics confirm its real-world reliability, achieving 92.3% sensitivity and 94.7% specificity. This means the platform is exceptionally effective at both correctly identifying individuals who are truly at high risk and, just as importantly, reliably avoiding false alarms for those at low risk. And finally, further analysis reveals that the model maintains exceptional and consistent accuracy across all three distinct validation environments. This versatility is crucial, proving that the algorithm is a robust platform ready for diverse applications, from mission-critical use in space to broad deployment in global health settings. In conclusion, cardiovascular disease is a preventable global crisis, but our current tools are inadequate. Insights from space medicine offer a novel, bio-driven, biomarker-driven path forward. The CardioPredict platform achieved 94.2% accuracy, proving to be more accurate and accessible than current methods. While not 100% perfect, this interpretable algorithm is a powerful first step to democratize preventative cardiology and saving lives. Future work will focus on integrating new biomarkers and applying machine learning for even greater personalization. So, what can you do? First, I encourage you to look for connections between seemingly unrelated fields. The next big breakthrough might come from a combination no one has seen before. Second, support projects that make medical technology affordable and available to all. And third, start conversations about the importance of preventative health. A more health aware community is a healthier community. These are some of the references that I used, and I'd like to take a moment to thank my family for their unwavering support, NASA for making their invaluable research data publicly available, and the Global Health Leaders Conference team for this incredible opportunity. Thank you for your time and attention.